Surface appearance of the nose. The external nose is said to have a pyramidal shape. The nasal root is located superiorly and is continuous with the forehead. The apex of the nose ends inferiorly in a rounded tip. Spanning between the root and apex is the dorsum of the nose. Located inferiorly to the apex are the nares, piriform openings into the vestibule of the nasal cavity. The nares are bounded medially by the nasal septum and laterally by the ala nasi, the lateral cartilaginous wings of the nose. Next are the sinuses. Sinuses are basically cavities or air filled pockets near the nasal passage. As in the nasal passages, the sinuses are lined with mucous membranes. There are four different types of sinuses. First of all, ethmoid sinus. This sinus is located inside the face around the area of the bridge of the nose. It is present at birth and continues to grow. Second is the maxillary sinus. The sinus is located inside the face around the area of the cheeks. It is also present at birth and continues to grow. Third, frontal sinus. The sinus is located inside the face in the area of the forehead. It does not develop until around 7 years of age. Lastly is the sphenoid sinus. This sinus opens into the nasal cavity via the sphenoethmoidal recess. This is the most posterior, which is the farthest toward the back of the head. Hello there.
Hello,
What's your name?
my name is Bishesh Bhattacharjee.
Okay, and what's your age?
My age is 16.
What do you do?
I'm a student.
Oh, so today, Vishesh, what we are going to do is we'll be testing, we will be testing your nose, your mouth, and the neck region or the throat. We'll do some confirmatory tests, and so is that fine with you, right?
Okay.
Okay, thank you. First of all, we'll begin the physical examination by washing our hands. This ensures that the procedure or the physical exam which I will be performing on the patient is sterile and aseptic. This reduces the chances of transmitting germs to my patient. Wash it more clearly and perfectly so as to reduce the chances of any transmission of germs. I would begin my nasal examination procedure by examining the anterior and inferior surfaces of the nose. Then I would check for some kind of deformities of the nose. There may be slight deviations of the nose, which is perfectly fine, no issues. But if the nose of the patient shows some major deviations, then it can be or can be indicative of some kind of abnormality present. Then, for checking any obstruction in the nose, which is very helpful in patients with nasal blockages, I would press one of the ala nasi and ask my patient to breathe normally. Then, after this, I would do the same procedure on the other part or the opposite side or the other ala nasi. This would give me a idea of any obstructions present in the nose or not. Then, by using an otoscope, I will flash light inside the vestibules of the nose. By flashing the light, I would get a clearer view of the nasal vestibules of the patient's nose. Then, by using the same otoscope, but this time I would use a broader cap on the otoscope to check the inner side of the nasal cavity. I would Insert the otoscope carefully inside the patient's nose and keep in mind to not disturb the nasal septum. By performing this, I was looking or try to look for any swellings, any exudates, any bleedings or inflammation in the patient's nasal cavity or any other grossly appearing structures such as polyps. There can also be ulcerations found in some patients having using drugs by the nasal inhalation. Next, for checking the sinuses, I would perform an examination which is just by palpating those areas or the sinuses. By palpating the sinuses, I would get a clearer view or get a clearer image of any swelling or edema found in those sinuses. Apex of tongue. The most distal or tip of the tongue is known as the apex of the tongue. Body of tongue. The portion between the tip and the base is called as the body of the tongue. Gingiva. Gingiva is also called the gums. These are the soft tissues that covers and protects the root of the teeth. Hard palate. The hard palate is formed by the maxillary bones in the front and horizontal portions of the palatine bones. Soft palate. The soft palate forms a muscular arc that extends back and down as a cone shaped projection called uvula. Uvula. Uvula is a cone shaped projection that hangs in between. Teeth. The teeth are the hard organs found in the oral cavity which are used for mastication or chewing the food. Mouth or the oral cavity. It is a hollow cavity which allows food and air to enter. It acts as an entrance point. Before beginning with the physical examination, I would ensure the safety of the patient. So, for this, I wore gloves on my hand so that there could be no transmission of germs from me to the patient or vice versa. So, to begin with, firstly, I checked for the outer surfaces of the lips. While doing this, I checked for the symmetry, the color, and the moisture of the lips. I also noticed or looked out for any lumps, cracking, or scalings of the oral cavity besides the lips. Nextly, I flashed a light and by using a tongue depressor checked the oral mucosa. While checking the oral mucosa, I kept into mind to look out for its color and also any ulcers if may be present in the oral mucosa. After doing this, I started to check the gingiva. While checking the gums, I noticed its color, its proper marginations, and also looked out for any edema or swellings or any pressure, checked the oral mucosa. While checking the oral mucosa, I kept into mind to look out for its color and also any ulcers if may be present in the oral mucosa. After doing this, I started to check the gingiva. While checking the gums, I noticed its color, its proper marginations, and also looked out for any edema or swellings or any ulcerations found in the gums. Moving on, I used the same tongue depressor and checked the teeth. While checking the teeth, I looked for its proper positioning, its color, and its shape. To ensure this more properly or to get a more clearer view of the positioning of the teeth, I held the teeth by using my index fingers and my thumb to check also for the loosening of any teeth. This was all done with my gloves on my hands. After this, I inspected the hard palate by flashing light onto it. After checking the hard palate, I asked the patient to say ah to
Ah.
widen the mouth so as to check on the uvula and
Ah.
soft palate movements. They were rhythmic
Ah.
or not, I
Ha ha
monitored
ha
that.
ha. Ha ha ha.
Then I used again a tongue
Ha.
depressor for getting a more clearer view of the uvula and the soft palate. For getting a more clearer view of the uvula and the
Ah.
soft palate. By using the tongue depressor, I depressed
Ah.
the tongue, which was getting in the way of getting an
Ah.
obstruction to look for by looking for the uvula. By doing this, I looked for any rednesses, any swellings or edemas, or any ulcerations in the soft palates. Inspection. I inspected the tongue. Especially, I looked for its color, its coarseness, which may be due to the papilla, or any other normal ulcers or any edematous appearing structures. By using a tissue paper, I held the tongue of the patient and then moved to one side to check for the undersurface of the tongue. This procedure was repeated again on the other side. By doing this, I looked out for any anatomy of the neck. The neck consists of many anatomical features. First are the compartments, which are the vertebral, visceral, and the vascular compartments. Second are the triangles. Anteriorly are the submandibular, submental, muscular, and carotid triangles. Posteriorly are the occipital and omonclavicular. There are also muscles. Suprahyoid muscles are the stylohyoid, digastric, mylohyoid, geniohyoid muscles. For the infrahyoid, they are omohyoid, sternothyroid, thyrothyroid muscles. Then it consists of the larynx. The larynx is made up of 9 cartilages: thyroid, epiglottic, cricoid, arytenoid, corniculate, and cuneiform cartilages. It also consists of the thyroid gland, which consists of left and right lobes connected by a central isthmus, produces thyroxine and triiodothyronine, and also the thyroid bone or the hyoid bone, which is the central body with paired greater and lesser horns. The various lymph nodes of the neck or the lymph nodes situated in the neck region are the preauricular nodes, postauricular nodes, occipital nodes, tonsillar nodes, submandibular nodes, submental nodes, superficial cervical nodes, posterior cervical nodes. All these drain the lymph in the region of the neck. Examination by noticing its position and alignment. I did this by standing in front of the patient and then looking for it. Then I checked for any masses or lumps found around the patient's neck. After this, I inspected for any swellings in the parotid and submandibular glands. Also palpated the lymph nodes using my fingers. While palpating the nodes, I kept in mind to check for its size, its shape, its tenderness, and its mobility. Then I started to check the nodes or the auricular nodes, postauricular nodes, occipital nodes, tonsillar nodes, submandibular nodes, submental nodes, superficial cervical nodes, and the posterior cervical nodes. Moving on, I checked for the trachea and looked out for any kind of deviation of the trachea. For palpation, of the trachea, I placed one finger on one side of the trachea and checked for the space between it and the sternomastoid. This should be equal to prove no deviations. Now, for checking the thyroid gland, I asked my patient to sip water from a glass. While the patient sipped water, I checked the upper movement of the thyroid gland and also looked out for its symmetry. Then, for confirmation, I palpated my patient to sip water again by putting my hands on the patient's thyroid gland from his back or the patient's back. Findings for today's exam include nose. The nasal mucosa which I searched was pink and it was normal. The septum was found on the midline with no deviations, and there were no tenderness when I inspected the sinuses. Now, for the mouth, the oral mucosa was pink, which is normal. The dentition or the teeth arrangement and alignment was all good without any loosening or any derangements. The throat or neck examination showed no exudates or abscesses which I could feel or any tenderness in any of the areas. These were my findings for today's physical examination. Thank you.